preserving empathy and trust in patient care. There's surveys and studies out there where there is some distrust of, the healthcare system. It might not be the individual practitioner or clinician, but it's that system. So you want to preserve that empathy. How do you do that while also introducing so much of the AI and the technology out there?
Yeah, no, I agree with that. So I'm a psychiatrist, and a firm believer that without the empathy, without that doctor-patient relationship, it's just not going to work.
Mhm.
I think there's countless studies out there that show that power of the kindness that doctors and nurses and the staff show is probably the most important part in the healthcare system. If you don't have that, it doesn't matter what medications you get. People just aren't going to trust it. They're not going to believe in it. They're not going to take it, or they're not going to have that mind-body, I think, connection that we really need to heal. And so if you don't have that, if you just have, whether it's just like a machine, an AI, an agent, a bot, whatever you want to call it, that's all you have. And there's no two ways. There's no listening, I think, to
Mhm.
the patient. There's no understanding, and there's no eye contact. There's no touching. Even just shaking someone's hand makes a big difference. I think if you don't have that, it's just not going to work. You really need, you need that human touch. You need that connection, because we are social animals, and you do have to do that. If you don't, it's just not going to work.